Our interactions with the non-clinical staff were actually great. They were all really wonderful. The PSAs especially, they would go out of their way to remember how you had your coffee. And it's something so small, but it makes you feel less out of control. And they would come around, they'd ask you how you were. They were always really upbeat as well, which I think when you're theoretically having quite a bad time, it's actually really nice to have someone come in who's got a smile on their face and just genuinely wants to know how you are.
I had really good experiences with the non-clinical staff, the PSAs, etc. I found them amazing in the fact that they do everything. They collect the blood, they bring the food, they clean, they do a lot of different things.
Yeah, they're very respectful and they're very committed because you've got to. They give you time to get out of their way if they need to get you out of the way for some reason. They don't push you at all. They won't interfere at all.
Reception staff, admin staff, they were wonderful as well. And especially, I think that willingness to facilitate what's going to work best for the patient.
The meal came and checked that it was okay, and could I open the lid of the drink and this sort of thing, which I did notice the lady opposite couldn't do, so that was a big help to her.
Staff greet me nicely usually, and I do the same thing, and we chat a little bit, and sort of like a nice relationship we develop. Some of them very nice, some of them were indifferent, but not many of them. Most staff were very friendly.
Cleaning staff, the people that came in and changed your bins and things, they probably weren't as friendly. They literally came in to just get the job done. And the same with the catering staff, they weren't as friendly. They were kind of like, here's your meal, here's, are you finished? Here you go. If they came in and they're like, good morning, how you going? A smile on the face, put the tray down, still 2 minutes of their time, or not even 30 seconds of their time, it would have made a huge difference. But they didn't do that, so I remembered that they didn't do that.
I suppose they're often not as friendly or not as, well, I suppose that's it, perhaps, not as friendly. A lot of them I think more just doing a job often is the impression you get.
I did observe some staff that weren't as confident as others, and I think there was sometimes language barriers. And the fact that they're also so busy, and I think just going from one thing to the next.
The staff on the reception, absolutely amazing, because they would greet me by name every time I walked into the centre. So they knew I was coming and they were like, hi Jess, how you going? Which made you feel so good and like more homely when you got here.
I found the staff to be really friendly and helpful. They were always at all times, but on the weekend it's a little bit more relaxed. Nothing else is open, especially on, and it's just admissions. So they were very helpful and always had, how's the weather, that type of nice relaxing chat. And again, you get to know them after, the 10th time of coming in. They know your first name, what's been happening, just very friendly. It's what you want to relax you. It's not a nice thing to come in all the time, and I just found them very, very nice. It just doesn't feel like you're a number. It just feels like that, it's such a big staff group, yet people remember you and they really feels like they care. They're working in the right place.
One receptionist who has a sort of a very particular sort of persona almost, and it can be very abrasive sometimes. Other times it can be very, very polite, but as a whole, I think fairly abrasive, and people notice because you're in such a sort of a sensitive and vulnerable place, and so you want the best care, and you don't want to be sort of you don't want, I guess, your feathers ruffled, I suppose, and that's what that does when you have sort of a negative interaction with a staff member.
There was one patient who came up to the desk and it was her very first visit, and she was angry because she couldn't find a car park and she couldn't work the machines. And I came, and when she got to us, I said, have you checked in with your Medicare card? She said, you've got to be kidding me. And I could tell straight away that she was just at the end of her tether. And I said, okay, well, let's not worry about that today. Let me just fix it all up. We'll do it all manually.
This person always seemed to me to be really busy, and obviously clearly got a workload to do, but it's their job to greet and meet, I suppose, and direct you to your appointment or to somewhere else, pay a bill or something, whatever it is. And this person was consistently made you feel like you're interrupting them and you were a nuisance.
Sometimes, you don't always have visitors, and nurses are very busy, so interactions with other staff are, really nice. Yeah, just help the day go through a bit nicer, and you don't feel so isolated.
There's a lot of sick patients out there these days that don't have any family or friends, and they're lonely and they're on their own, and all they need is that 2 minutes, morning, with a smile, and it's not hard.
The chats went both ways. It depends on personalities, I guess. There's a couple of the older PSAs that would always say hello and how's your day going. And then every time, because I came into hospital I think about 10 times, so they'd remember your face and how you're going, and often stop and seemed genuinely interested in how I was, which was really lovely.
She cared about you as well, and she would build a relationship despite having quite poor English. But yeah, she was a character and she was lovely, and that came through regardless of the language barrier.
I think when you kind of met with people that kind of have a negative attitude, you're not going to ask, oh, is it okay if I push this because I really wanted to go to my daughter's birthday or my granddaughter's birthday or something. So I think when you're approachable, patients are going to ask, and if they ask, it could make a big difference in their lives.
Greet them with a nice greeting.
I always say my name. I say, hi, I'm Sharon. Because if I'm meeting someone socially, I'd say, hi, I'm Sharon, what's your name? We just try and sometimes make it comfortable by being natural.
So I will say like this, hi, I'm Azan, I'm a patient service assistant, and so just wanted to ask you that, are you feeling comfortable? Have you got a good sleep last night? I'm here to take you down for a safe journey for your scan. If you need anything, you can ask me, but it will take 5 or 10 minutes to do this.
Sometimes I start the conversation, other times the patient starts the conversation. Depends what day they're having. We try and take the focus off the treatment they're having and just talk about other things.
If they've had a bad experience on the first day, they're not going to want to come back. It's really important that we make that first impression count.
Mostly talk to the family members as well, just to say hello, and a lot of them like the interaction too.
So I try to treat them as normally as possible, and a lot of the male PSAs will really relate to the blokes, and they'll sit there and talk about the footy and everything, and while you're having chemotherapy and you're sitting in an armchair and you're talking to someone about footy, it just makes the time go fast.
We are very calm all the time. Make sure I'm with them. I'm kind of them.
Most patients like to have a chat, and we've always got time for a chat.
How we speak to the patients and my demeanour and how we assist has an impact on the patient.
It's easier to be pleasant back if someone's being pleasant to you, and often it de-stresses you a little, and it makes the whole environment a lot better.
It's amazing what a smile can do. Like, I know it's not easy to smile 24/7, but I think when you're communicating with patients, which most patients in this centre are going through an experience that they've never gone through before. They never thought they'd be going through this before either. So staff members saying good morning makes a huge difference.